Afternoon, everyone. My name is Heidi Diamond, and I lead the charge for content partnerships, distribution, syndication, and licensing at Healthy Nation. And I'm delighted to be here together with you all today. First and foremost, I hope everyone is home, happy and healthy, and enjoying the glorious fall weather, at least here in New York. It's beautiful. We're looking forward to having you join us for Populus Media's first annual Telehealth Symposium, and what is sure to be a lively and informative discussion all afternoon. A couple of quick housekeeping items. If you don't mind, if you haven't already, it would be ideal if you kept yourself on mute. We will have an opportunity to have you ask questions. You can use the chat function, and we're going to get to as many of those questions as we can throughout the afternoon. Also, just a quick note, there will be a survey that will be sent out afterwards, and we very much look forward to your feedback as well. Quick programming note, pleased to also welcome today Russ Barons from Evofem Biosciences. Russ will be joining us in the 2:35 session. And also Nina Slifer from Ogery, and Nina's going to join us in the final session today. And so to get the program started, let me first welcome Paul Tyson. Paul's the CEO of Populus Media. Paul co-founded Populus in 2019, and you're going to hear from him and some of his fellow co-founders today. Please enjoy the conversation. Paul?
Thanks, Heidi, and a big thank you to everyone for joining us today. We're super excited. On behalf of the entire Populus Media team and in partnership with our friends at Healthy Nation, it's my pleasure to welcome you all to the first annual Populus Telehealth Symposium. We brought together today leading voices from the telehealth industry, ad agencies, and pharma brands to explore the booming telehealth sector and hopefully to discover opportunities for patient engagement, education, and brand messaging. We'll hear from telehealth CEOs and physicians, as well as pharma brand marketers who have already invested in telehealth media, and they'll share their insights with all of us today. I recently had the pleasure of speaking at length with two telehealth experts on the state of their industry, and please enjoy this conversation now with Dr. Lyle Berkowitz and John Pierce as we kick off our first session. Enjoy the afternoon.
To discuss the current state of the telehealth industry. John Pierce is the founder and CEO of Zipnosis, a very successful telehealth company based in Minneapolis. And Dr. Lyle Berkowitz has over 20 years of experience as a primary care physician, an informatics and innovation executive, and a health tech entrepreneur. He is currently CEO of Back9 Healthcare Consulting. Previous roles include founder and chairman of Health FinTech, and he was the chief medical officer at MD Live and director of innovation for Northwestern Medicine. You can find more information on him at drlyle.com. And he likes to go by Dr. Lyle. So Dr. Lyle, welcome this afternoon, and John, same to you. Great to have you.
Yeah, great to be here. Thanks. Thanks for having us.
So let's kick it off. You are both experts in telehealth. We're going to learn more from you. We often hear that telehealth has been around for 20 or more years. It was just waiting for that magical moment when technology and consumer preferences converged to drive the industry to much greater scale. And so here we are. It seems like this is the magical moment in 2020. Want to ask you, what has your experience been over the past year? And to what extent do you agree with the statement that the pandemic has essentially disrupted healthcare in a matter of just 6 months? John, do you want to kick it off?
Yeah, absolutely. So I completely agree with that statement. And I think what's really interesting about it, when you look at the trajectory of telemedicine and virtual care, is that it literally took a pandemic. It literally took a massive forcing function to get the healthcare industry to change and adopt. And I think for someone who has been sitting here for 10 years saying, hey, the cell phone's the clinic of the future, there's a better way to do it, et cetera, it was frustrating prior to COVID to just see the glacial pace and just see how hard it was for healthcare to sort of get out of its own way. But it literally took that kind of level of what we saw with COVID to enact that change. And I think the message that we have, and certainly what we're seeing, is that that change is going to be very durable, that we're not going to have sort of this slingshot where we go back to sort of pre-COVID. These are fundamental changes. And obviously there will be, some turbulence along the way, but we're not going to go back to a world where telemedicine and virtual care is cast to the side anymore. It's definitely going to be front and center. Care delivery and sort of all aspects of healthcare are going to have to really integrate it within their day-to-day practice.
Great, thank you, Dr. Lau.
Yeah, so let me add on in the following ways. One, we've been doing telehealth and healthcare for 100 years, right? I mean, phone-based care, et cetera. So that itself is not new. But what we didn't have, as John said, was sort of this forcing function to really make it a more regular part of care and to get paid for it, et cetera. I call it the 3 R's. There's a reimbursement component, which due to both phone and video being reimbursed at parity, that's made it fully acceptable by doctors to feel comfortable trading off office-based visits. There have been regulatory changes that have made it easier in a variety of ways at both state and federal levels to do telehealth. And third, I'll call the regularity. Just people are now used to it because all of a sudden it was the only thing to do. Both doctors and patients who had never done it, been exposed to it, all of a sudden felt comfortable with it. So the question is how much each of those 3 things will remain, because that will be the telling point on the consistency of this. There's no question the proverbial genie is out of the bottle. And at what level it will remain will depend on those 3 R's. I'll also add not just telehealth, but lots of innovative things. There was a well-known meme that went around early when this started, which was the multiple choice question, which we love as doctors, which is, what caused the most innovation in your healthcare system? Your CEO, your CIO, or COVID? There's no question. We all know what the answer is.
Fantastic.
No, I think that's a great way to summarize it too, Lyle. Those 3 R's really are important in understanding, specifically for telemedicine and virtual care, because the regulations specifically, when you think about it, were just a Gordian knot, and it meant that it was really hard for anybody to do virtual care at all, right? Across state lines, hard to understand where licensure sat, et cetera, et cetera. And some of those changes, especially around licensure and the regulatory environment, I think are going to be some of the biggest tailwinds behind the durability of virtual care. I think the place, and then, where there's probably the most unknown right now is really around reimbursement. And we've seen this huge shift, right, to parity and in office visits. Most of, I think, our conversations, that's probably not going to last forever, but it's not going to regress. And more importantly, we're seeing so many more CPT codes and reimbursement opportunities around a broader spectrum of virtual care services, which is really, really promising. And then I'll tag on there, I think the best marketing for telemedicine was COVID, right? I mean, it kind of sounds a little crude, but it really was, to your point. And it forced people that were sitting on the sidelines to use it. And they're like, oh, actually, that wasn't too bad. And I could do this. And so I think you're absolutely right. Those 3 R's are the ones to pay attention to.
Great. Thank you. Well, another question for both of you, kind of a follow-on question is, has anything surprised you in the past year with the spike in volume within telehealth?
Yeah, I'll start in just saying my biggest surprise is how much doctors actually like this. I'll be honest. I was of the impression that there'll be a group of doctors who are virtualists who just do virtual care, and that the doctors who are doing office-based care are going to be happy with that, not going to want to mix it up. I was wrong. I've found in talking to my colleagues across the nation, hearing from health system executives, how much doctors actually like having some aspect of virtual care. The combination of, they can help people who couldn't get in easily, et cetera. They obviously get paid for it. But when you give them the opportunity to work from home for a day, doctors aren't used to that. They love it. It is a bit of a sea change for them. And like I said, that was my most surprising moment, how much they actually enjoy doing some of that as a mix into the routine care.
I think the most surprising for us, and so our business is really providing technology to healthcare providers. So health systems around the country license it, and then they are the clinicians behind it and kind of their brand on top of it. So we have a really interesting viewpoint kind of behind the scenes of what's happening. The thing that was most surprising, outside of just the sheer spike in volume, I mean, that was out of left field. I mean, nobody anticipated that. And just historic growth by any industry at any time. I think it was really surprising to see how fast the healthcare system mobilized. And we saw, health systems, out in Tacoma on the, the front end of that spear. Every day they're changing their practice behavior. They're changing how they're thinking about care delivery. And that pace I'd never seen before in healthcare. And I think that's a real testament to, obviously that the impact of the change that COVID had, but also the commitment that the healthcare system had in serving the populations. It was pretty remarkable, actually.
Yeah, I'll add, it was great, and it was less surprising to me because I've always felt we knew we could do it. We just needed to have that push.
Yeah.
And it also makes me feel like we're going to use this as an example for years. Again, my innovation colleagues were like, I've had all these things on the table ready to go that I couldn't get done. And all of a sudden, my executives are coming and say, hey, can you do this? Can you do this? And, we've been thinking about it for so long, as we often said, that the ideas aren't new, the execution's important. But I agree that they actually did it relatively well and really quickly. So I love that as well.
I think one of the other things, Paul, too, that we've seen is, at least in our experience, a lot of virtual care was a pretty narrow band of the population. And what we've seen now is that it's anybody and everybody, and it's raised a tremendous opportunity to engage with, patients. We had our first, I think, a patient over 100 to a visit, a month or two ago. Never before would we have touched, someone over 100 with virtual care. And, pediatrics is another area where it kind of been a little bit, perceived as a little bit risky, but now it's kind of front and center. How are we engaging with families and their care and the whatnot? And then of course, it's raised an opportunity to touch a much bigger population on a much more regular basis. And I think that's been one of the cool things that's emerged out of here.
That's great. That's super interesting. I'm going to move on to a question for John. And we saw on your website just a great quote from you as the founder of Zipnosis. And I quote, when I started Zipnosis, I knew we could create device agnostic care that offers patients greater choice and convenience, offers providers efficiency, and boosts the bottom line for health organizations. And I knew we could expand this beyond urgent care to fill more gaps in the care continuum. It's working, end quote. John, can you share what your vision was and how you've been so successful building Zipnosis?
Yeah, it really started with this notion that the cell phone was going to be that clinic of the future. And you could see how healthcare was shifting out of hospital-based settings into ambulatory surgery centers, into retail clinics. This would have been 2008, 2009 when I was really starting Zip. And it just became clear to me that next stage, that next place was obviously cell phone or sort of the digital realm. And when you think about sort of our trajectory and how we've looked at it, it was really, instead of saying, hey, let's just put a video visit in front of a normal sort of encounter, we really took the time to go back and say, let's reimagine how patients and providers connect for care. And let's look outside of healthcare at other e-commerce services, other digital services, learn what they've done really well, and then try to bring that into the healthcare ecosystem. And admittedly, it was a little ahead of its time. And as everything we kind of talked about, regulations weren't there. There weren't incentives for a lot of that kind of change to happen. But in this post-COVID world, this is what we were built for, right? Where consumers do have choice, where their interactions are really important, where you have to have good unit economics at scale because there's so much volume on the system, right? You can't sort of obscure it through some financial wizardry. So we really think ultimately that this is the golden hour for virtual care and telemedicine. And I think part of what's made us successful in that is remaining committed to that, transforming that patient experience, and then a good underlying thesis on how do you make it scale profitably.
Great. You mentioned volume. just a thought around, because folks don't maybe know what the kind of typical volumes are, last year versus this year. Could you share any kind of non-confidential information around Zipnosis's volume scale up this year?
Yeah, so we were pretty transparent, especially during the spike in COVID. That was part of our commitment, was to be, as transparent as we could with data. And so, we saw a spike. I think March 9th, we did about 1,800, 1,900 visits across our health systems, for example. And generally, when you look at telemedicine adoption, 1% to 2% of overall volume was pretty typical. You just kind of think of on a relative basis. March 17th, we saw about 65,000 visits go through the platform. And we're on the shift now where, I think 20 to 25% regular cadence utilization of virtual care is going to be the baseline. And certain specialties are definitely going to see more of that. And generally, for those of, that are getting oriented to the industry, let's assume maybe we did 10 million virtual visits last year. I don't know. I mean, just a rough approximation, right? We're well on our way to do 100 million, right? And 200 million. And that's the trajectory that we're on. And it's really exciting to see there.
That's awesome. Thanks for sharing that. I'm going to switch over to Dr. Lyle. You served as the Chief Medical Officer and EVP of Product Strategy at MD Live, one of the larger US telehealth companies out there. Dr. Lyle, could you give us an idea of kind of what that experience was like and what the learnings were from being inside of a telehealth company as a physician?
Yeah, let me give a couple thoughts. One of the first things I did was put it on my innovation hat and said, what problem are we solving? I want to make it clear, the problem we're solving is not how do you replicate a 15-minute office visit with a 15-minute video visit. Yeah, that's nice for patients, but it's not particularly efficient or scalable for the system. So we really went in saying the problem we're trying to solve is how do you take care of a medical issue in as efficient and high quality way as possible. And whether that is phone, video, asynchronous, how do you improve that process? Gave us a different thought when we thought about product. I made sure everyone on the development, product, engineering team was thinking along the same route. Second, satisfaction. I was responsible for patient satisfaction. We said, so it really became clear. Patients love this, assuming one, they got a timely answer. Two, they actually got an answer that they felt comfortable, and particularly they got prescription, because that's what they all think that they need. And three, it depends a bit on how much they have to pay for it. And people who were unhappy were ones who often had to wait and then were told, there's nothing we can do. Either you just have a virus or you have to go to the ER. And how do we better manage that? And we started doing better triage and prep education work. The third issue is utilization. How do we get people using this? And it's about awareness and of course, lowering the cost to try it. The first place, once they tried it, they were actually often pleasantly happy and wanting to come back. But getting them to use it the first time was like really tough. It costs a lot of money because particularly when the focus is on urgent care, which we were doing at the time, you've got to somehow educate them just at the right time that they need it. Fourth thing is quality of telehealth needs to be thought about with respect to not how does this compare to what you would have done in the office, but how would this have compared to what would have happened if nothing was available. In a lot of cases, telehealth is the only lifeline people have. And so access is a huge part of quality. And finally, I'd say that the biggest opportunity for telehealth companies outside of urgent care is, I'm going to suggest preventive care. Chronic care, there's definitely something there as well. But I think the next big opportunity is going to be wellness preventive care because it's pretty easy to do, whereas chronic care can be a bit more complex. I think remote patient monitoring and then escalating to a doctor is a lot easier. And this is also an example where it's a telehealth company with independent physicians without a relationship, acute care, urgent care, and preventive care easier. I think chronic care is going to be best done with the doctor who knows you well. And John's company has a lot of experience in that because it works with the health systems who do it. I'd be curious, going back to John, how many of the visits and et cetera are done by the patient's actual doctor, and whether that differentiates between urgent care, chronic care, preventive care in the model that you've set up.
You know, it's evolving, Lyle. I mean, pre-COVID, it was almost none. And that's been an area where we've definitely made the most product improvements and probably seen, you know, much bigger adoption. I'd say, you know, we still sort of focus more on the on-demand kind of stuff, which is great. But again, that's what part of our new world order is. That's going to be just a portion of our business instead of 80% of it. And I think the the opportunity for patients to continually connect with their an existing provider is profound.
Excellent. I'm going to switch back to John real quick here. So consumers love the advantages of apps and technology. It makes our lives theoretically simpler. But it also, you know, we're all overloaded with tech in our lives. So talk to us about telehealth. Does it make our lives simpler, or does it just add another app that we have to worry about and complicate things?
Well, I think like anything, and Lyle hit on this, where we see the best satisfaction is when we can meet consumer expectations, especially around their time. So what has been really consistent in doing this for a decade is more than price, more than can I talk just with my doctor, do you value my time? And I think where telemedicine and virtual care is going to be effective, whether or not it's an app or otherwise, is again coming back to meeting those kind of expectations. And obviously cost has a role in that. But absolutely, and it's interesting, when I was getting started, I was explaining what virtual care was to my mom, and they were all like, you're crazy, and like, you're gonna do what? But she got it. She's like, well, just cut the crap, right? Like, I don't need to go in for this. I know what I've got, these kind of things. And I think there's a little bit of that sort of no nonsense mentality, where if we can continue to be a part of that, if we can fit in the slipstream of your life as a patient, as a consumer, I think we can be effective. I actually think, pre-COVID, healthcare was one of the most disruptive things in our life, right? People would be like, John, you got this disruptive code. And I'm like, actually, if we do this well, we're not. We're actually making healthcare much easier for you to access. So yeah, there's a lot of apps that are out there, and some of them are not going to work. But I really think the ones, especially around virtual care, are going to be the ones that you put into your daily slipstream of life, and then it will be transformative. And I think we'll be very surprised by that pleasantly.
Fantastic, thanks. Dr. Lyle, switching to you. So you've been a physician associated with Northwestern Medical for over 25 years. What are physicians and healthcare leaders thinking in the fall of 2020 relative to telehealth and what they have to do, what they want to do now that it's a changing landscape?
Yeah, I think one is just an operational issue. Who and when and where are we going to be doing telehealth? I've seen a couple of models. For example, one model is where you tell your doctors, hey, 1 or 2 days a week, you're going to be doing telehealth. You can do it from home. Sometimes they may have them come in the office, but you'll sort of be dedicated for a big chunk of hours. Another model might be, you can have intermittent telehealth throughout your schedule. So you might have an office visit, then a telehealth visit. You might split it up, half days, etc. But I think figuring out what models can make the most sense can be really important. Second is, of course, going back to reimbursement. One is we already know many payers which have been waiving co-pays for telehealth are going to be reinstating those. Now that's reasonable. You would have had to pay a co-pay in the office, but it will probably have some impact on patients' interest in doing telehealth or ability. But more importantly will be what will happen to reimbursement for phone and video. Will they remain at parity? I think people watch that closely, and I'm going to ask John a second to comment on reimbursement for async. I think it's criminal when we're reimbursing for synchronous but not async. I think all forms of virtual care should be reimbursed. I also think we're going to see payers pushing probably a little pressure on this, like cutting down the costs. I think that will happen because they want to see us move into value-based care and how we're going to be able to switch. I would say my general advice to health systems is to recognize that even in a fee-for-service environment, there's a variety of things that are non-reimbursable visits, which are not even counted in all the statistics. So pre-visit triage and intake, post-visit education, monitoring, these are important aspects that we can easily automate and virtualize. And the more we do that, we actually are making things better for patients and more cost effective. Classic example is post-surgical. instead of making a patient who just had surgery come in so you can look at their wound and say, that looks fine, and then you can go now, have them send in a picture asynchronously, or even if you do a video visit, and that is a lot easier and better for the patient. And second, it's already bundled as part of the procedure cost, so you're not billing for it anyway. And so it's actually better all around. And again, we didn't have this push because it wasn't regular before. So when we look at some of the statistics and we talk about, hey, X number of visits, % of visits are done by telehealth. Remember, those are only billable visits, not counting all the non-billable events that are happening by telehealth. I think that's a hidden currency of telehealth that's happening. And I think any health system needs to both figure out how to have experts in telehealth, but also figure out how this is now the new normal.
Excellent. That's terrific. Thanks so much. Very informative. We're actually down to our last minute, so this is the speed round. Final question for both of you. Put your crystal ball on the table, look 5 years forward, give us any insights, or go 10 years if you want, and tell us what will telehealth be then if it's different from what we have today.
Well, yeah, I think the biggest thing is going to be around the new business models that are going to start to tack on there. And we talk about value-based care, but I see so much opportunity outside of sort of traditional healthcare, where I think the virtual visits themselves will become, to a certain degree, sort of loss leaders for other business models. And generally, we're moving from this idea that we have these discrete events that you get paid for in healthcare to this stream of data and stream of interactions. And I think that's going to transform how we think about healthcare in ways that are fundamentally different. So I think to be a little bit more specific, I think it's going to be assumed that virtual is a component of almost every single healthcare interaction. And I think that it will start to look, I think it will take time, but I think you will see new business models built on top of that assumption as well.
I'd add that I hope we don't use the word telehealth. We don't say telebanking, telecommerce, etc.
Thank you.
Right?
Yes.
It's just healthcare. And I'll talk about the 3 A's and a D. So from a technical perspective, 1, automation, autonomous care, chatbots, etc. My gosh, I think a lot of healthcare can and should be fully automated. You don't need a doctor for routine, repeatable things that have clear evidence-based medicine, and that will be easier and more efficient. Second, asynchronous, which John's a master at, I think will become increasingly more important. We don't need synchronous care for a lot of what we do. It's not the best use of everyone's time. Third, A is ambient AI listening. I think that now we're seeing bubble up, actually listening to the communication, whether it be in person or via a phone or video, to actually create the documentation, add value, etc. I think will be a cool new technology. And finally, I'll add digital diagnostics, vital signs, image analysis, etc. will make the virtual visit that much easier, better, higher quality, etc. To the point where, in fact, an office-based visit may seem not nearly as high quality and as efficient as having someone whose information is being calculated at a regular level and presented to the physician in a format that is so much easier in a virtual world.
Excellent. Thank you for that. Gentlemen, Dr. Lyle, John Pierce, it's been a terrific session. I think the audience is really going to benefit from your wisdom, your knowledge about telehealth. Thank you so much for joining us.
Have a great conference. Thanks.
Yeah, thank you, Paul.
Thank you.
Bye.
Terrific indeed, Paul. I loved when Dr. Lyle said that doctors do love working from home. I'm wondering if they too are wearing their tie-dye sweatshirts when they're doing their virtual visits. And I was gobsmacked when John talked about 200 million in telehealth visits. That's a staggering figure. For those of you that are just joined, just a couple of housekeeping items. Be sure to check the agenda at populus-media.com. Our next presentation is titled Multiple Facets of Telehealth. And our good friend Ray Rotolo, who's Populus's Chief Product Officer, is going to tell us about the various approaches to telehealth and what's being delivered to patients here in the US. So with that, we will now see Ray.
Good afternoon, everybody. My name is Ray Rotolo. I am the co-founder and chief product officer of Populus Media, and I want to offer everyone my personal welcome to our first annual Telehealth Symposium. What a really great first session there was there with Paul, John, and Dr. Lyle, and you'll be in for a great rest of the afternoon. Today, for the next 10 minutes or so, in the next session, we're going to talk about modalities and what modalities mean in telehealth. So what exactly do we mean when we say the word modalities? This has a specific meaning, obviously, from the dictionary, but from a telehealth standpoint, what exactly does it mean? Modalities essentially provides the means for the interaction of patient and HCP within the visit structure. Essentially, we're talking here about connections and interactions, how patients interact, how they connect with the HCP within the actual visit itself, how they're having that consultation, what their discussion points are, and how they're managing through all of that. In the very traditional sense, there was one modality in the past, right? You walked into your doctor's office, you sat in the waiting room, you went to the exam room, and you physically had an interaction with the physician, face-to-face, direct-to-direct, and had that interaction that way. However, obviously, over the last 7 or 8 months, don't have to even say this, telehealth has thrust its way upon the healthcare delivery scene and changed the way patients are interacting with HCPs on a daily basis across multiple ways. I think the one everybody's really familiar with is the video visit, and I think that's the one everyone thinks about when they first hear the word telehealth. However, there are many different types of ways that a patient can interact, either by a specific platform. So one platform, one telehealth provider could have a very specific way of doing that interaction, or they could have many, depending on that platform itself. And it's the patient choice. So it really comes down to how the patient is choosing the way to do that. But again, very different than it was in the past. You had one specific way. Oh, you may have had a phone call with your doctor every once in a while about this or that, but the true way to see that, the true way to actually have that consultation was to sit there in that office. Not anymore. It's changed. It's now much more flexible, much more safe, and much more efficient for patients throughout the telehealth environment. As I mentioned, the one that everybody realizes and understands is the video visit, but there are other ways to do that. The 3 other ones that I think are the most profound within the space right now are asynchronous, which is essentially a series of questions that a patient answers that a doctor reviews, and then either comes back with a confirming that diagnosis, asks for additional information, etc. There's very traditional chat, again, a very familiar experience for patient in that regard. And then there's the very, very, very traditional phone consultations, as I mentioned before. For this particular presentation, we're going to concentrate on these first 3 because I don't think I need to concentrate on the phone. I think everybody understands what that is all about. So the video visit, again, the one that everyone's mostly familiar with when they hear the word video, telehealth. Video is a face-to-face, a one-to-one interaction. It is synchronous because it is live, and I think that's a very important word to understand here with regards to telehealth, the telehealth environment itself. It's very reactionary and visual, obviously. You can see the doctor face-to-face. It is, again, very, very familiar to the patient because it's traditionally the way their doctors, sitting in the doctor's office and that face-to-face visit. It has that show and tell experience here, right? If you had a dermatological condition, you can actually show the doctor a rash or whatever it may be on your arm through the camera. Again, very, very visual, very, very show and tell in that regard. And it is mandatory in some states to write a prescription. Not every state, but there are some states that will require a face-to-face video visit in order to write a prescription. And again, not every state, but there are states that do require that for specific types of prescriptions. Again, video is one that everybody understands, but it can be intimidating to people, right? Seeing that doctor face-to-face in that regard. So there are other ways, there are other choices that the patient may have to visit that doctor. The next one, as I mentioned before, is something called asynchronous. So asynchronous, by definition of the word, is not live. It is store-forward technology. So it's not live with the HCP. It's a series of Q&A questions that a patient answers, which is then forwarded to the HCP so that that HCP can make a decision. Essentially, those questions are filling an EHR for that doctor. They're going to review that, and they're going to come back to that patient with either confirming that diagnosis or saying, hey, I think we may need a face-to-face visit for this, or I need additional information from you. Do you have past test results you can give me, or things of that nature. Again, by the nature that is not live, it can drop wait times. So for some of the platforms out there now, it could help reduce all of those times that patients are waiting. And that store forward technology is very important for that. Scripts can be written in an asynchronous environment. So as a patient is giving that information, a doctor is confirming a diagnosis or believes it's a diagnosis and believes a prescription is appropriate for that, they can write that prescription. As I mentioned, it's becoming a very popular option because it's a little less intimidating than that face-to-face visit. And it's even, especially more for things such as urgent care. I mentioned dermatological visits before, but things where you don't really need to have that face-to-face consultation, you may be able to answer some questions and the doctor can give a pretty easy diagnosis on that. Again, it's not something you're going to see for elaborate diagnosis or things of that nature, but much more for some urgent care type conditions. The third one is chat. Again, a very, very familiar environment for most patients, literally for everyone, right? It is synchronous. So again, there's that word again. So that means it's a live interaction between doctor and patient. It's very comfortable and familiar, as I mentioned before. Patients have been used to chatting on phones and on tablets for forever in that regard. And so they're comfortable in doing and working within that environment. It's a very simple discussion tool for patient and physician. Again, it's not really there for some elaborate types of discussions or consultations, but really good for that immediate, I need an answer right away type thing. It can accommodate numerous specialties, including behavioral. So that's really important too. So if you just need to talk to someone, if you just need to contact someone, especially in the behavioral modes, but nowadays with anxiety and other types of things that are out there, there are platforms, telehealth platforms out there that are focused just on chat so that you can quickly talk and engage with a specialist immediately on that. So again, it can really accommodate certain types of things in a very important manner. And as I said before, scripts can be written in this environment. So again, very important from a patient perspective and what they need as a result of that visit. So I want to get into one that I think is familiar for people, but maybe not familiar for some other people, and that's remote patient monitoring. And it is a new and growing modality in telehealth. By definition, remote patient monitoring is the continuous monitoring of vital patient information. We've seen that now for diabetic control through constant glucose monitoring. There is the ability now to do heart and blood pressure monitoring with the advent of digital stethoscopes and things of that nature that can carry that and bring that telemetry back to the HCP. Even for medication intake, right? So it's a recording of medication at specific times and specific doses that a doctor can look at and see over a period of time. So it's that continuous information, that continuous flow that's really important from a treatment standpoint. This is pretty obvious, obviously, with the new and engaging forms of 5G and connected medical devices, including the Apple Watch and all that, the healthcare facilities that can provide, and other types of units. I mentioned the digital stethoscope before. All of this is going to be very important for that connection with the patient, that continuous connection with the patient, and give the doctor and patient the ability now to consult each other, even if the patient is not in a clinical setting, and that they need that constant connection for specific vital information. Data is going to be a key, right? So this is a great way to collect and continually collect data over an ongoing period of time. And that data is going to be key on a number of reasons, right? As you look going forward, the ability to monitor dosage and time of day of that dosage, types of therapies that are giving over periods of time. All of that information now can be captured in real time and utilized to unlock the efficacies of that therapy and maybe give the ability to change and tweak certain things at certain times that can really help in the overall solution for a particular patient in a specific condition. So really, really important in all of that going forward. And I think it's going to be a very exciting part of what modalities are going to look like in the future. Things are going to change, especially with 5G. And as I mentioned, all of these connected devices that are now hitting the marketplace from a healthcare delivery perspective and a healthcare monitoring perspective. It's going to be a huge, huge boon. Again, not only from a marketing and media standpoint, but just think of this from an overall healthcare delivery standpoint. It could help patients leave the hospital in clinical settings sooner than they were before in the past. So really going to be important as it goes forward, and a very, very exciting part of what modalities are going to look like in the future. Well, that wraps up my quick 10 minutes on the modalities in telehealth. I hope you enjoyed it. I hope you learned something. Thanks.
Gotta love Ray's enthusiasm and his passion, equally as exciting as our first two speakers. For those who have just joined us, just a reminder, if you would like to see the agenda, it's at populus-media.com. And as well, I'd just like to encourage anyone who has any questions, please use the chat function. We'll try and get to as many as we can throughout the program. Next, we're going to hear about an innovative product that just recently launched on telehealth. We would like to welcome our guest, Russ Barons. Russ is the Chief Commercial Officer at Evofem Biosciences. Last month, Evofem launched Phexxi, a groundbreaking biologic women's contraception product that was approved by the FDA earlier this year. Russ is joined by Howard Seidman. Howard's the Chief Operating Officer of Populus Media. Welcome, gentlemen.
Thank you.
Thank you
very much. So when we think about the interplay between telehealth and the marketing of healthcare products and services, it's important to discuss how telehealth can impact the conversation between consumer and product. How can we positively affect the consumer's ability to make a decision and connect with treatment options quickly, efficiently, and cost effectively? Earlier this year, Populus introduced Custom Connect with this value proposition in mind. Custom Connect created the closest opportunity for an equivalent to e-commerce ever created for prescription medications. Custom Connect is the only platform presently that's integrated with a brand's marketing assets, follows the consumer from lead acquisition all the way through their journey to becoming a patient when medically appropriate. The data on every touch point during this journey is not only collected and analyzed in real time, it's also reported in a de-identified aggregated basis back to our client. For the first time ever, our clients have real-time actionable data at their fingertips. This data has enabled our clients to convert browsing consumers into actual patients at the point of contact in a very cost-effective manner. At the same time, we're providing consumers access to excellent care that's immediate and cost-effective. With regard to medication promotion, there are some widely accepted standards. These standards include the differentiation of a drug through messaging, as well as traditional sales forces calling on providers to educate them about a product. This year, Evofem made telehealth a core pillar in the launch of their new medication, Phexxi. To our knowledge, this is a first. This has never been done before, quite frankly, as far as we're aware, in an initial drug launch. So with all that said, congratulations, Russ, on your launch. Things appear to be going well. I have a couple questions for you, if you don't mind answering them.
Absolutely. Happy to
Super.
hear it.
Good. How has this telehealth-based concierge program impacted your medication launch?
So we launched what we call Phexxi Concierge Experience. And Howard, just as a quick little note here, the reason we don't really call it a program is because we want it to be an experience that leads to something. And I know that when I did my first telehealth video chat with my doctor, it was an experience. First of all, I had to help them actually navigate through it because they didn't know how to do it. But by doing this platform, what it's done for us as we've come out of the box is it's really helped us to get off to a fast start. We're in an environment, of course, where salespeople may not have access to offices and they're trying to get in to see HCPs. But because we were able to jump out of the gate really strong, over the first few weeks, we saw really several hundred women start Phexxi, and that was based on some of the geotagging that we put into place to really understand what our ROI was on doing this.
Excellent. Excellent. So explain to me what made you decide to make this approach core to your launch?
Well, the most important part of this concierge experience was to make the commitment to drive it right at launch. So, we're all in the same boat, right? We were chugging along, ready for our approval, and then, COVID hits. Now, before this had happened, we'd actually been, discussing what we would be doing relative to telehealth, and we believed that it was going to be an important part of our platform to start with. this took off, and within weeks, I pulled the team together and I said, listen, we have to, without question, make telehealth one of the most successful things we've ever done. In fact, my challenge to him, Howard, was I said, we need to make this so successful that the Harvard Business Review writes us up as a case study for how do you launch a new product in the middle of a pandemic. And that really was my challenge to them, Howard. They said, make sure you do it this way so that we can do that. So first, we ensured that our digital advertising strategy really drove our telehealth solution by helping these women understand how they could get a prescription within minutes. And that's a key part of this whole process, is make this experience so positive that women want to do it. Then we incorporated a support system, for example, the nurse hotline. And this mechanism really helps women. So if they come in and they're not really sure if they're ready for an RX, they're helping move them along that continuum to get to that point. And by the end of that first week, our nurse support line had already seen and talked to over 250 women, and 75% of them were moving through the process to speak to their HCP. And about half of them decided to go into the telemedicine side. So, it was really working very well for us right out of the gate. And then the last thing I'll say on that is, our recruitment was one where we partnered with social media. We wanted to make sure that we were being pretty specific about deploying in areas with algorithms in Facebook and Instagram channels to bring to women into this Phexxi experience based upon these certain behaviors. And that for us has always been a key thing, is we recognize that we have a product that is for women who are beyond hormones. And if you can identify them by their behaviors, you can move them through this channel into a lot easier way. So we brought women into Phexxi.com and went through all these different channels. And then they were able to link to the telehealth medicine there. And then they complete a survey. And that survey is only taking about 3 minutes on average for women to get through the channel. So then it determines if they're right for Phexxi. And to be real honest with you, almost every woman's going to be, because there's just very few things that would disqualify them. And then if they qualify, then they can move into, as we've heard and we talked about, that asynchronous discussion that can happen, or they can go to an HCP or have an in-person visit. And there's a small cost that is associated with it. It's that copay, the same as if they were going into the doctor's office. Somewhere between $30 or $45 is how that happens. And then upon completion of that, they end up making that visit, and they're offered to either go to the mail order pharmacy, or they can go to their local bricks and mortar if they're more comfortable with that. So we currently have about 55% of them that are going to mail order. And so really, in short, our commitment was to really make this a part of our launch. And I had said to my vice president of marketing, if you don't pull in 50% of the scripts that we get out of telehealth, then we're probably not going to make it in this time of COVID and when everything shifted. So, every day I'm kind of saying, where are we at? So as I already kind of told you, we're already over 55% right now. So he's feeling like he's done his job.
Gotcha. Great. So explain to me the differences to the ways that you may have otherwise launched the product. Take telehealth out of it for a second. How would you have launched the product, and what would you have expected?
Well, before we had COVID hit, we were planning on a typical size sales force for a women's healthcare sales team, which is about 125. We would have had the typical number of 100 to 125 physicians on each person's panel, and we would have gone out and kind of done the same thing, and then hit a few of those other people with some of that non-personal promotion type of stuff that you do. But one of the things that we really thought was different, and for us, our approach was going to be, and I look at some of these other companies that have been around for a while and have massive infrastructures, and I say they're a little bit like an ocean liner, and it's really hard to turn. That's why the Titanic sunk. and I said, we have got to be like an America's Cup sailing yacht, which means that whatever happens, we can pivot, we can move quickly, we can turn it around on a dime. And it happened. So Howard, that's what I think really was going to differentiate us from, as a startup in a way that was different from other approaches that might be taking place.
Interesting. So talk to me about your legal process on getting this approved. How did that go? This is new. Especially for a brand new launch. talk to me about that particular hurdle, if it was in fact a hurdle.
Yeah, well, Howard, for almost any marketer, that medical legal regulatory process is the bane of their existence. And so,
That is true.
it wasn't really any different for our team to some extent, because initially when you brought it up, and again, we're a startup, there's two fears. One is, we don't have any history yet. And the second is we're not a Pfizer. We can't afford a big fine if we make a mistake. So you kind of had that process to go through with our MLR team for them to understand. And initially, I think a lot of times, especially legal, when they look at this, they go, "Oh my God, you can't have that kind of conversation with a woman. You can't get that information." And so, through that process of helping them understand that, HIPAA was kept in place, that we as a company weren't gathering any of that information ourselves, and all that. Once we kind of got them comfortable with it and understand what it was and how we were trying to go about that, that really worked. Now, one of the biggest challenges we probably faced, quite honestly, was, the questionnaire that you have to qualify these people or these women when they're going to come through this process. That's kind of out of our control. I mean, that's not really, we're not the ones at that point. They've been passed on. And trying to help them understand that we've actually passed them out of our landing page and website into another environment was a little bit of a challenge, but we got through it. And I think overall we made it with a few long meetings, but we made it.
Yeah, gotcha. No, I agree. I was right there with you. As far as some of the early results of the program, again, nothing proprietary. You talked in a general sense about it a little earlier. How's it going?
Yeah. So just if we kind of take out that first post Labor Day week, which was a short week and stuff, we've had over 500 women already go through the telehealth path. We're averaging about 250 women a week that are going through that. About half of them are booking an appointment. So we suspect that going forward, when we start looking at this, that our numbers, and again we partnered with you all to kind of try to establish what we felt like was a reasonable amount of conversion that we would be able to put into some kind of a forecast. And, right now we're so far exceeding that right now, knock on wood, it's a very positive opportunity. And if we're on this trajectory, we'll definitely beat what we had forecast as not just our telehealth part, but our overall launch.
Great. With this particular cohort of patient, what was your thinking? How'd you know it was going to work? What were your thoughts pre-launch on how this was going to actually be received by your audience?
All right, so truth in advertising, so to speak, if you will, is my vice president Tim Glennon got pretty high on it and came in and tried to sell me on it. I was a little bit skeptical of the point of saying, "Come on, buddy," and so he brought me actually to a meeting with you all, and we had that discussion, and it was really through that time that I kind of started getting this realization that maybe this was going to be an important thing, not to get left in the wake, but make sure you're breaking the waves, so to speak. And one of the things that we had talked about, I remember in that meeting, was this Kaiser Family Foundation article that had been put out there, and that they were saying how the rise of telehealth was really taking place in their experience, and that about 60% of all their visits in their network were being conducted, sort of in a telehealth, and that they expected that by the year 2025, and this stuck with me, by the year 2025, more than half of all of Kaiser visits would be telehealth.
Wow.
And I remember walking out of that saying to Tim that if that's true, I said, this is Blockbuster and Netflix, Tim, and we cannot be Blockbuster. We have to be Netflix. And so you cannot allow yourself to get stuck into this model that we can't, navigate. So that was really the beginning of why we kind of went there. But then when we dug in deeper, we realized women's health was already one of those areas that was highly utilized among telehealth, if you can call it that, even though it was at a smaller level as overall amount of visits at that point.
Gotcha. Now let me ask a question, less about facts and more about opinion. Do you think this is a cohort specific kind of attribute that fit telehealth perfectly, or do you think that this is reachable to other cohorts and other disease states?
Well, certainly while we are in a, as contraception, the data suggests that more than 90% of the time, a woman will say to her physician, this is what I'd like, and they grant it, right? So we were already in an environment that did that. However, the one thing that I've said, and I said this to investors as we were preparing to get, launched, is I said, there's two types of change that happen societally, right? So the one change is change that I'm trying to influence, and I'm trying to get people to do something different. And the other change is forced change. And I use the example of Rosie the Riveter. So, World War II came along, and women up to that point had basically stayed at home, taking care of children, being housewives. And there was a resistance to women having jobs, except for, cashiers, bank tellers, and phone operators.
Right.
And then they went into the factories, they went into the offices, and it was a forced change, and society never went back. Today, there's more women in the workforce than there are men. And I said, this is why I think this works at this time, because this forced change has put everybody into this category. So I don't think it is just one therapeutic area that would benefit from this. I mean, there might be a few out there that are really more difficult, but by and large, my guess would be, again, you said opinion, 75 or 80% of all therapeutic areas could probably do well in this area.
Super. Well, that's all the questions I have, Russ. Thank you very much for joining us. I appreciate it greatly. Thank you.
Thank you, Howard. It's been great to be with you, and I appreciate your opportunity to let us talk about it.
Absolutely.
Bye.
Thank you both, Russ and Howard. And Russ, good luck on that HBS case study. I also am a graduate school professor, so I'm rooting for you guys. Next, we're going to move on to another lively discussion. I'd like to welcome Paul back and my colleague at Healthy Nation, Dr. Preeti Parikh. Preeti is Healthy Nation's Chief Medical Officer. And in addition to that role that she plays, she's a board-certified practicing pediatrician here in New York City. She's an assistant clinical professor at Mount Sinai. She's also a spokesperson for the American Academy of Pediatrics. So she's got quite the hat trick working here in terms, she's a triple threat, as we say. She likes to combine her clinical, her academic, and her journalistic chops. And she too has been right there on the front lines. She apprises us at Healthy Nation on a regular basis of what she's seen throughout the pandemic. And Preeti's ultimate goal is empowering people to achieve their optimal health. So let me turn it over to Paul and Dr. Parikh.
Hi, Dr. Parikh. Nice to see you again. How are you?
Good. Nice to see you.
Thanks for joining us. You and I had a nice chat a few days ago, and I was fascinated with how telehealth is being used by you and your colleagues in pediatrics, especially the way that your team ramped it up, as the pandemic took off. So now that you've had 6 months, 8 months, whatever it's been, as a team and individually to understand how telehealth hopefully helps your practice in this current environment, what are some of the learnings that you and your colleagues have had about telehealth?
So it's really interesting because prior to COVID hitting in March, we hadn't actually implemented much of any kind of telehealth. We had some asynchronous and also, just as some other doctors mentioned earlier today, about phone calls and FaceTime, but nothing formal. And in the last 6 months, it's been amazing how we've been able to implement it into our practice. And now 6 months later, although we're out of the craziness in March and April, where we were trying to get it going and also keeping those sick patients out of the office, managing how to see those people, especially in New York City, a lot of them had left the city, and also we couldn't accommodate all those patients in our office. So now 6 months later, we've learned that not every visit has to be in person. Actually, the American Medical Association has found that 75% of the visits do not need to be in person. And we found that our no-show rate has improved significantly, that patients with telehealth are able to make their appointments much easier and not missing them because they're able to do it from home or wherever they're at. So it's been amazing to see that also, that our no-show rates had dropped significantly. And then we also realized how we can incorporate this in our practice, where we used to struggle of getting all the patients that we needed to see in our office at a given time. So now we have a doctor that's set at home, which is great for the doctor also, because now there's some flexibility, that they're doing a whole telehealth day. And so they're from home, they can see patients, they have patients scheduled that way. And we can also still see our in-person visits and do our staffing in the office the way we need to see those patients. And also with COVID, we also can't see the same number of patients in the practice because our waiting rooms cannot be filled. We need time in between each patient to clean the rooms. So this has been a great way that we've seen that we've been able to utilize this technology to really give our patients the services they need, to not expose them, and also that they have more flexibility, that they can actually not have to come in for everything and they can stick to their appointments.
Fantastic. That's great. So would you say it's made your practice easier? It's in some ways maybe it made it harder, or maybe it's just different?
So it's a combination. So it's made it easier in the sense of flexibility for both the patients and the physicians, in terms of lifestyle, for physicians also to have that opportunity. And then even for our patients to have that flexibility, where we've actually improved on our follow-ups, like things like asthma, ADHD, where sometimes people are not wanting to always come in for everything. And so then they skip those appointments. So that has made it much easier for both the patient and us to keep those follow-up appointments. And sometimes even some of those sick patients that don't have to come in, we've been able to do that. Some of the challenges is how to incorporate all of that, because we have a doctor from home doing it, but then even in our practice, we've had to also keep up with our in-person, and then going back and forth between in-person and also telemedicine. So how do we schedule our patients and the doctor's time? Because if you're running behind, then you don't want to be able to not be able to see your patient on time, and going back and forth. So we've been struggling a little bit with that, and working out those kinks.
Gotcha. Well, pediatrics is certainly a unique application of telehealth. And on the one hand, you're treating your patient who's probably under the age of 18, and in many cases 5 or 6 years old, what have you. But there's a caregiver or a parent in many cases, I believe, that's also sharing the screen. So can you talk to that a little bit about the unique aspect of pediatrics and telehealth and how it's used?
Yeah, so one of the interesting things that we've also learned through telehealth that we could use it as, when I see a patient in the room, I have a 15 to 20 minute time period with them, and they're nervous. Most of the kids are like, am I getting a shot? That's what they're fixated on. And we have to really depend on the parents to tell us all about their developmental milestones. We're not able to see everything. And so now that we can actually do telehealth and do telemedicine at home, I can actually see the child in their own environment. So I could see them, how they're talking to their parents, how they're picking up things, their fine motor, their gross motor skills. For ADHD, my adolescents, I can see their room and see, how did they set up their room? Are they organized? How are things going? And also I had just yesterday an eating disorder patient who's an adolescent who felt much more comfortable talking to me at home and showing me the types of food she's eating. And so that has opened up a whole other level of involvement and much more information for a pediatrician, because we can't always get that when we only have 30 minutes in a room where they're half the time nervous to even talk to us. So it's been great.
Sounds like it. Absolutely. Had this question for a participant in this event early in the afternoon. Look at your crystal ball, look 3 to 5 years ahead. I mean, what do you think telehealth is going to do, and where will it be in 5 years, if you have any ideas around that?
Yeah, I think it's not going anywhere. I think it's exciting because before COVID, I think there was a lot of hesitance for a lot of reasons, because of reimbursements, because of acceptance between patients and doctors to use it. And it's a new technology, and sometimes that takes a little bit getting used to. And I think through COVID, it showed how efficient and how amazing it can open up doors that we can see you have much more interactivity with your physician, and you can actually see them more often and keep up those follow-ups. So I think in the 3 to 5 years, it doesn't completely replace in person, because I still think physical exam and those things are still important. But I think for a lot of follow-up visits and other urgent care visits, especially in fields such as endocrinology, oncology, pediatrics, we just heard about women's health, that they don't always have to come in. So it will be another part of our practice, which will be much more robust. And so we will see a lot more engagement and patient satisfaction and follow-ups, and hopefully adherence and compliance, because now that we have this tool that we can be more in touch, we'll be able to see if the patients are keeping up with their medications. Are they able to keep up with their testing and they keep up with all their numbers and values, and make sure that they're keeping up with what they need to.
Great. We'll sort of riff a little bit on the future of telehealth, and you as a professor of clinical medicine at Mount Sinai. So med school students come through. I mean, do you see them getting trained more in telehealth than perhaps your cohort did coming through? I mean, is it, maybe you don't know yet, it's too soon, I don't know.
No, definitely. I mean, even myself, I mean, texting with patients, we saw some asynchronous, like the chatting, synchronous chatting, but I use a lot, and I show my medical students how important sending videos and also text articles combined with infographics to my patients as follow-ups, because when they come to see you, there's not enough time for them to absorb all of the information. So our medical students are teaching them how important it is that educational materials need to be followed up, and using telehealth as a great opportunity. Even in my practice, we have patient portals. All the major hospital institutions, Sinai, NYU, Columbia, my practices, all have now patient portals where patients can access their information, and we can actually send them educational materials through their patient portal. So it's been really, really great. And medical students we're really showing them how important to use these tools for their practice in the future.
Excellent. Putting your Healthy Nation cap on just for a minute, talking about the patient experience in telehealth, and maybe talk to the value of that opportunity of presenting information to a patient before or after the visit, i.e. video content, short form video content before or after the visit. Just some thoughts on that?
Yeah, so health literacy is a huge issue that we're, in the medical community and in the public health community, we're trying to tackle, is really making sure people are understanding what, their medical condition is and how to really empower them. And this is where I think video has shown to be a huge player in that, where we actually have seen health literacy guidelines where they see not only just text, but actually see infographics, someone doing things. Having bullet points of text material is really important for health literacy, and everything that we do should be at no more than a 5th grade level when it comes to health content. So video is a great opportunity to really educate the consumer. So the way we see pre and post visit, for example, pre is they can actually help facilitate the visit. So when we send our patients, sometimes I have an asthma follow-up, and I send them a pre-video and pre-information sign up where they talk about questions to ask. How many times have you used your inhaler? Things like that. So it spears up conversation. When I talk to them, they're not totally, oh wait, I don't know, I don't remember, let me think about it. And also the video beforehand can spark conversations about, oh, I heard about this new treatment or this new diagnosis. Maybe this is something I have. How do I go about checking if I have that? And then when it comes to post-video content, I found this to be especially helpful in terms of making sure they understand how to take their medicine. Is with asthma, is it a rescue medication or is it a maintenance medication? Do they understand the difference? So that can help with adherence and compliance. Also, how to take the medication using an inhaler versus a nebulizer. So when they see it versus just reading about it, it can make a huge difference. And this is where I think video is such a great tool for education.
That was just a great answer. Thank you so much. Very informative. We actually have a question from the audience. Matt is asking, with regard to patient support programs and co-pay support from manufacturers, what type of opportunities have you seen used to provide patients with additional support materials?
So pre-COVID, I would have pharma reps coming in and they actually give us their presentation and then they'll actually give us physical coupons to give to the patients. And that said, I think there is a new opportunity now where it could be more digital, and it would be unique to see if we can put it on our patient portals, if doctors can do that, or have some sites that they can tell them that they can go and get these coupons. Because prior to COVID, I would always have, they would come and just give me a stack of coupons to give out to our patients, and we would have an area where people can see which coupons we had and they could take it. But in this new digital pharma reps, we've had to limit who can come in. So I think there's an opportunity for a digital opportunity to send to the doctors where they can maybe put it on their patient portal and have an area where the patients could check out and see if they're eligible for those deductions.
Okay, great. Let's see here. So just back to content for a moment. Again, thinking about pediatrics, because we were on that track of talking about how valuable content is. What sort of content works in pediatrics? You're talking to the child, you're talking to the parent, the video is trying to do two things at once, possibly. How does that work?
So for pediatrics, it usually is more geared towards the parents because they're the ones who, especially like developmental videos in terms of how to, when they're younger. But then there are some videos that we actually do a lot for adolescents and a little bit older kids in terms of study habits, if they have ADHD, organization skills. So there are, and nutrition actually is a huge one that we've been working on also for children to get them engaged, because data has shown if you want them to eat healthier, you really have to involve them in picking the foods and educating them. So we do a mix, but it is a combination that we definitely have to engage both the adults, and then as they get older, school-aged and older kids, we definitely are also gearing content towards them, and actually even preschool kids in terms of behavioral things that we've done some content on how to help them with behavioral issues and engaging them.
Excellent. We're bouncing back and forth, but we had a question from someone else in the audience to the answer just prior to this one relative to copay support for manufacturers. And Ryan's asking, regarding that question about copays for manufacturers, would you be open to receiving that kind of information via your telehealth platform?
In terms of for the giving it to your patient through that? Do they have, like sending them after a visit, giving them a
Yes.
coupon after? Yes.
Ryan just said yes. That's what.
Yes. Okay. I think it would be a little bit tricky, but it could be something that could be potential. I think the only issue is that we don't want to be seen as promoting a certain drug necessarily, and them thinking that because we have that coupon, we're going to be using that medication more, but there could be a potential for that. Or just address or sending them to an area in a patient portal where we have all different coupons there, that maybe seem as a little bit more not biased toward as a physician. That may be an opportunity. Because one of the big struggles as a physician too, we want to keep our objectivity and making sure that patients don't feel that we are, kind of leaning towards one medication for a certain reason, if not medical, but financial reasons.
Understood. Okay. We're just, we got a minute or two left. I thought maybe for the audience, those who have children in the audience or those that are expecting, as a pediatrician, do you have any words of advice, like kind of what to expect over the next year as things change and telehealth can be done from home? And we know the waiting rooms can be a bit hectic and much different than they were 6 or 9 months ago. So to give them some comfort, what would you tell them right now?
I think it's such an exciting time in terms of for medical care and using telehealth. So for instance, in my practice, our lactation consultants for the new parents that are now, the moms that are going to be breastfeeding, they don't have to come into the office every time to get that support. Our lactation consultant does telemedicine, which has been huge, because when you're a new mom, the last thing you need to do is wanting to schlep to the doctor's office. And so that's great. We've also been able to do so much better in terms of developmental follow-ups. I mentioned earlier too. So that's been, I've had a couple of weeks where I check in and see how's their motor development going. And there's the families are so happy because, again, they could do it in their own home environment where the child is more comfortable. So we actually see a lot more. And then also for urgent care, some of the stuff like conjunctivitis or like where your eye's infected, you don't always have to come in. We can do it over telemedicine. So for a lot of my working parents, that's been a blessing. And in pediatrics is another unique area where parents, patients don't really like to go to urgent care or to places where they don't know the doctor, because they really do form a special bond with their pediatrician and really do trust them. And so even if a patient has to go to urgent care, they always call me to double check, did the doctor diagnose it correctly? And so I think with telemedicine, this helps take that out. And a lot of times I don't even have to send them to urgent care, that I can do it over the weekend via telemedicine. I can look at the eye and say, you know what, I'll just prescribe you the antibiotics. You don't need to go to urgent care. Whereas before it was a little bit trickier to do. I couldn't do that just over the phone. I needed to see the patient. So this has been, I think for parents, it's a blessing that you have much more access to your pediatrician in the future.
Sure.
Yeah.
That's a fantastic answer. This is actually the last one because of time, but I think it's really interesting. Hillary asks us, will telehealth attract more moms to become doctors?
I think so. I think this is a huge improvement in terms of being home, especially I have 2 children, and when they were studying at home and having childcare and having that opportunity, I've had a lot of colleagues where it's been a blessing during the pandemic also to have that flexibility, to still have that relationship with their patients and continue the work that they love, but able to also be there for their family needs. So I definitely, already pediatrics and OBGYN, we've seen a lot more women going into those fields. And I think this just is going to improve medicine overall for all medical fields. I think this hopefully for men and women improves some family time.
Absolutely.
And flexibility. Yeah.
I think that's a great one to end on. Dr. Parikh, I really want to thank you for your time. It's been a fascinating conversation, I think, for everybody. And we wish you all the best with your practice in these tough times. And, let's keep in touch.
Yes. Thank you so much for having me.
Thank you. Have a good day.
Bye.
What a great example Dr. Parikh just gave of helping us to visualize just how much empathy and personalization a telehealth appointment could be. Dr. Parikh was talking about, she was advising a young adult with an eating disorder yesterday over telehealth. And it's just such a great example of how empathy and personalization can be achieved in a telehealth visit. Next up, happy to welcome Justin Freed. Justin's the Chief Growth and Innovation Officer at CMI Compass, and he's joined by Ray Bertolo, who's coming back for round 2.
Thank you, Heidi, very much. Appreciate it. Justin, welcome.
Thanks, Ray.
I also want to add one other accolade to Justin. He was recently named to M&M Magazine's 40 Under 40. So congratulations on that, Justin.
Thank you, Ray. Yeah, I had to let everybody know I'm not too old yet. So
very good. Well, again, thank you for joining us. And so let's just jump right into it. Obviously, we've talked about it all throughout the program today. Telehealth has just experienced this just tremendous growth over the last 7 or 8 months for good reasons and for not so good reasons. However, even prior to COVID, telehealth was looking at the acceleration factor, right? It was, you looked at forecast double-digit growth over the next 4 or 5 years. It was going to be where a lot of doctors were going to do things as things move forward. So it was there on people's radar, but was it looked at as a potential media channel? Did you guys see it as something that could be used to engage patients within that construct?
yeah, absolutely, Ray. And I think, I look back, even though it seems like it was years ago, you were in my office at the end of 2019 and the beginning of 2020, and we were actually talking about Populus and what you were doing and kind of how we were going to be able to bring the advertising, the media aspect to life. So I think it's been one of those things we've seen, looking back over those couple of years, it has always been, how can we get involved in telehealth? And as you know, CMI Compass, we work with a large portion of the top 20 pharmaceutical companies out there. And it's been a wait and see, and let's try to build this with this partner. Let's try to build that with that partner to bring this solution. We knew that the uptick in use was happening. And it was really a need for the technology and the opportunity to advertise on the platforms to really match up with the demand.
So it was more of opportunity.
Exactly.
And having that opportunity. Yeah.
We wanted to do it. We wanted as an agency to do it. Our clients wanted to do it. It was really, I think in many cases, technology causes innovation,
Sure,
right?
sure.
If you look at, way back in the day with the first smartphone, that caused things to change and open new opportunities. With this one, people were actually chomping at the bit saying, hey, how can we, get our brand or get our parent company in front of people during the telehealth consultations?
So that kind of leads me to my next question in regards to how clients and how agency folk as yourselves look at it. Is this more, do you see telehealth as more of an extension of what's happening in point of care and the growth in point of care? Or could be looked at more on the side of what digital, because obviously there's the digital components of what healthcare actually is from a structural basis. Where do you see it falling as we go forward? And looking at it from a pure media perspective, is it more POC? Is it more digital?
Yeah, I mean, at the end of the day, and this is a personal belief as well as kind of our belief at CMI Compasses, I don't think it really matters where it falls. And the reason being, really what you need to do is understand all of the opportunities to engage, whether it's a consumer or a patient, right, or a healthcare professional. You need to understand the opportunities to potentially deliver a message and influence a decision, a change in their behavior. Hey, let me ask my doctor about this, or hey, let me look into the efficacy information about this drug, right? It's about that influence. Now, where that influence falls and when it falls is, I think, what makes telehealth so important. And what you can say about POC, or in the case in the HCP side, the point of prescription, right. It is a really influential channel or tactic because of the timing. I mean, it is at the point either right before or potentially during when decisions are being made about a prescription. So, to me, I'm leaning a little bit more towards if you made me choose one or the other, it's a little bit more related to POC. But I think it's just influence in the treatment journey is exponential compared to other channels. Like if compared to somebody just reading an article on Medscape or something like that, it's just right at the key point of when decisions are being made.
Yeah, I mean, exactly. I think that's what makes it so exciting as we look towards the future, is the ability there to not only to engage those patients with that type of content, et cetera, but also to educate them and really influence kind of not only, as you said before, the way they look at their decision-making process, but also how healthcare in general is going to be delivered for them and what the efficacy of that actual consultation is going to be. So very exciting in that regard, in that sense. At least that's the way I look at it. I'm sure you probably feel the same way in most cases. Given the thought there, which you were just saying, I think one of the challenges that's been faced in the initial stages of where telehealth media actually is and the point of where it's going to grow is the results, metrics, those types of things. And, point of care has very specific types of metrics they look at when looking at that. Obviously, ROI studies, things of that nature that look with regards to that. When you take it over to the telehealth side, that's where you kind of get into a little bit some different issues with regards to how, can you find script lifts and things of that nature there? There's privacy issues that are associated with that and all of that. Do you think, and again, from an opinion standpoint, are we going to need to find, or to take what we've already seen from that perspective of how we can look at ROI, bring that to telehealth, find a way to make it fit, or will we be developing new metrics with regards to how telehealth media is resulted?
Yeah, this is a really good one, right? And so I think there's a lot of opportunity to prove ROI in this channel. So especially because it's digital, right? So if you look at POC in office, there's a lot about what foot traffic is actually coming into that office, as well as the prescribing behaviors of the healthcare professionals in that specific office that can be tied back to it. I think one of the benefits that telehealth brings in, because it is digital, that if you're able to look at a digital ID, and obviously in a completely compliant way, right, where we are not saying it is Justin Freed getting consulted, right? But we're able to see ID 1234 and my behaviors as a consumer based on my digital profile. And being able to turn that in, accompanied with data, prescription data and RX data from the healthcare professional side, and matching that together. So I actually think this is a more measurable channel than traditional in-office POC because of the digital aspect that plays here and being able to connect it to that single ID potentially.
That's a really, really interesting point and a really interesting take that I tend to agree with. I actually think the digital nature of telehealth is going to make it much more reliable in that regard, to where we could build an ROI metric that makes a lot of sense in that regard. Obviously, we've been talking a lot about D2C, direct to consumer, and what it means in telehealth. How important is the other side of that? Obviously, there are two faces of that screen, right? One facing the consumer, one facing the HCP. Are you seeing clients even ask about how we can engage healthcare professionals in the telehealth environment?
Absolutely. I'd say, the interest is definitely, from the get-go, those first requests that came in a couple of years ago, it was about the consumer side. And still to this day, it's a strong part of what we do and how we work with you all, right, on the consumer side. But absolutely, there's a need and an opportunity on the healthcare professional side as well. It's interesting when you look at the opportunities to advertise to healthcare professionals. So we do a lot of research at CMI Compass about kind of behaviors and preferences of healthcare professionals. And obviously, brand preference is important. But one of the other things that we also find with the HCP audience is that they have trust in the parent company too, right? So their belief in this company in the diabetes space, or this company related to oncology, or this company related to, multiple sclerosis, that carries weight too. Especially if you look at some of the, disease states where there's a lot of switching, right? Maybe some chronic diseases where they try you on this medication but move you to another. There's definitely opportunities to help build that trust level and that respect level from the healthcare professional office, not only with an individual brand, but also with a franchise or a portfolio of products that a company may specialize in. So absolutely, it's something we're starting to see more and more of requests for, especially today in our world where we know reps aren't getting access, right? I mean, that's a key driving factor here. And it looks like Q1 that's not going to change. And even when things go back to normal, will that one-to-one rep engagement occur like it used to? I don't believe it will. So there will be a need for additional non-personal promotion, and specifically over telehealth too.
Yeah, and that kind of echoes a lot what Russ Barron said a little bit earlier in our earlier session on what they're doing in telehealth, what Everfem Biosciences is doing. So that's a really interesting take in that regard. Obviously, you sit as the Chief Growth Officer and Innovations Lead at CMI. You see everything that's coming about. What is your long-term view of telehealth as a medium? Is it a truly sustainable channel? Is it something, as we've seen all the growth forecasts, it's going to continue to grow? There's that settling back to I hate to use the word new normal. We've heard it so much over the last bit of time, but is it something that is going to be a mainstay on media plans? Is it a line item in media plans going forward?
Yeah, so I think it's really interesting. And technology is one of the reasons I love the position I'm in, is I get to look at technology and kind of figure out what it's been doing and what it's going. And if I think back to certain points in 2018 and 2019, we considered telehealth as an industry, we considered telehealth as an innovation, right? And it's that new shiny penny that we want to have something in to say, hey, we're doing telehealth. Now it's become part of, the everyday treatment cycle that HCPs are giving to their patients. I've also personally, so I have a son with a rare disease, and so we've been using telehealth as part of that. So instead of, I'm in Philadelphia, and outside of Philadelphia, instead of driving an hour downtown to, CHOP, we're able to do telehealth here from our home and keep in contact with our doctors. So it's been a big relief on us. And I can tell you just from personal experience, when we go back, we'll go in when we need something done. But if it's just a nice check-in every 6 months with the doctor, that is so much easier for working parents. I also think, you're going to see those folks that we've called digital natives, right? That grew up with a cell phone. They're eventually going to be the key target for a lot of the companies that we all work with. It's not going to be those people that today are 55 and older, right? Those people are getting older, and those digital natives are starting to fall into that. The millennials are approaching 40s now. So that technology adoption definitely happens quicker with some of those generations. And once we've got a taste of it, are we going to want to go back? And I think you heard, you know, the speaker before me kind of say that there's probably not going to be that drastic shift all the way back to what that normal was. That we'll definitely continue to see growth and adoption within the telehealth space.
Yeah, and I think you kind of mentioned some of the key points there. It's, you know, the ease, the efficiency, the safety now, obviously. And we believe that that's going to be a huge component of where telehealth is going to be with regards to how you look at some rare disease states and how they're treated going forward. Vulnerable patient populations, as we always say in the industry, in that regard, and that safety mechanism that telehealth can provide, and where that means to all of that. Justin, I want to thank you for this. We want to wrap this up here. I appreciate your time. And again, thank you for your thoughts, and hopefully you found this engaging as well as I did.
Absolutely right. Thank you so much.
Thank you, Justin. Appreciate it.
Ray and Justin, thank you again. Justin, congratulations again on your 40 Under 40 award from MM&M. You millennial you, says this boomer. Last session, we'd like to welcome 3 healthcare media veterans who are going to discuss how telehealth is impacting the entire ecosystem. Jeff Erb is with us, and Jeff is the president of McCann Health Engagement, and he's joined by his colleague, Hilary Gentile, the Global Chief Strategy Officer at McCann Health. And as mentioned at the top of this program, we're also delighted to have Nina Silfer join us. Nina is the healthcare lead at Ogery. And so let's welcome this trio for our last fireside chat.
Thanks so much, Heidi. Glad to be part of the event, and happy to have us. I'll let Hilary and Nina introduce themselves.
Hi, yeah, this is Hilary, work at McCann Health Strategy. Have loved the conversations thus far, taking copious notes, so very happy to be here.
Hi, Jeff, can you hear me?
I can indeed.
Awesome, thank you so much for the invite. I love being a part of this. As you know, telehealth is near and dear to my heart. I am the category director at Ogery for healthcare. We collect mobile data signals and we turn that into really reliable and usable data for brand marketers out there within the pharma space.
Great. So when we look at the rise of awareness and adoption of telehealth in the past year, especially as it's been talked about quite a bit today in the wake of the COVID-19 pandemic, people have been really trying to get their arms around understanding a new paradigm in caregiving at a really extraordinarily rapid rate. And the opportunities the platform affords patients include providing care in remote locations, being able to engage with physicians from home during a pandemic, providing a safer means of follow-up appointments for more severe conditions that don't necessarily require an in-person visit, home delivery of drugs, and even leveraging connected devices for remote monitoring of patient conditions. The platform has also had a demonstrative impact and efficiencies for practices, payers, employers, and pharmacies. And with all the different modalities that we talked about today, this rapid adoption rate, and with the recognition that there's a significant impact across stakeholders beyond the patient, there's clearly needs for education, support services, and other elements beyond in-consult marketing and condition education. And we've seen companies like Evofem transform their advertising and digital assets into the closest equivalent to e-commerce that the RX industry has ever seen. But we're clearly only scratching the surface of the opportunities within the industry and the support needs at every touch point and with every stakeholder. So with all of that said, we've heard a lot of this conversation about intercepting the patient at the moment they engage with the physician and how to advertise them. But do you agree that this is only one facet of the total opportunity within telehealth? And I'll open it up to both of you for your perspectives.
I'd like to go first.
You get to go first, Hilary.
Oh, me? Okay, great. Yeah, I think this is one facet. I think what's interesting that we've seen, and we've done work recently on understanding conversations between doctors and patients, and the candor. Who knew that video could be so personal? The candor that you're able to have in your own living room with your doctor is opening up a lot more conversations. But that said, when you leave that conversation, the ability to take what you learned, what you understood is very difficult. So understanding what happens after that telehealth visit is a great touch point from a health literacy and a behavioral aspect, kind of when that conversation is completed.
Yeah, and I would just continue on Hillary's point. You know, I'm really excited just being in this data world and kind of understanding AI, how it works, how to be predictive with when somebody uses telehealth. I think is kind of the next phase of the platform in targeting and a brand marketer's opportunity, you know, to preempt, you know, if somebody is using it seasonally, or, you know, to Justin's point, if they are using it regularly to check in on chronic conditions. I think that really fascinates me. I'm really excited to kind of see how, you know, knowing that a lot of these telehealth experiences are enfolded into the EMR platforms, which are generally connected to like a Zoom or something very similar to what we're on right now. It's going to be interesting to see where this space goes and how the Googles and the Zooms and the Teams all kind of respond to this opportunity in creating a more rich experience and you know, kind of virtual waiting room in these predicaments.
Great. And what do you feel that doctors need to do, or what patients need to do to make the overall telehealth experience really effective, and how can we as marketers support that?
I'll go again first, and then you go next. You go first the next time. So I think what's interesting is when you're in the moment, you want to know, you know, sometimes you forget what you exactly want to address. I think what's interesting is, imagine if you had your dashboard, and I think your point of that combination of your EHR record in front of you, almost like a dashboard of understanding. I think that's something for how are we going to help people navigate our conversations, get even more efficient with those kind of behavioral kind of change. But then after it, I loved the beginning part of the conversation, that there's going to be more touch points. So how do we take that and make that almost like a playbook so we can continue better health, better understanding, and then better outcomes?
That's a great idea.
Yeah, I think, you know, that's excellent. And I think that, you know, this whole time frame and not being able to see your doctor or have those conversations organically from, you know, as of 7 months ago, and all of us kind of learning how to adopt to this new space, it really requires us to be, you know, more conscientious of the way that we take care of ourselves, and having tools and utilities with our phones and, you know, different things in the household to take care of yourself. I make the joke that, you know, not being able to see my dentist, I floss like 3 times a day, but that's one, you know, microcosm of this, and like just being able to, yeah, have access to my chart, understanding, you know, what your heart rate monitor is saying to you every single day. To be more connected and involved in your healthcare is extremely important. I think, you know, doctors investing in tools like TytoCare. I don't know if anybody's familiar with that company, but they're coming out with devices that can be in home where, you know, doctors can diagnose a variety of different ailments just in the comfort of your own home. So I think that, you know, the advancement in technology, both from the patient and the doctor side, is crucial.
Cool. So do you guys feel that there's certain groups of people that might benefit more from being better prepared going into this? Are there certain demographics that you think might be more that need that kind of engagement ahead of time?
Yeah, so I mean, that's certainly, there's tools at our disposal today, right, without investing resources in technology advancements, that we can kind of prepare to reach doctors now, right? Taking pictures of different things before, you know, your appointment, or having a log of, you know, incidents that have happened that you're getting ready for your appointment. So I don't know, I mean, definitely the millennial audiences are potentially more advanced in using some of these tools. But I do think that it spans, you know, some of the research that Ogre has done. Some of the leading, you know, early adopters of telemedicine have actually been boomers, you know, 55 to, you know, and over 65 plus. So I think it just depends on, you know, the willingness to adopt, but I think it spans all demos.
Yeah, and I would just add on to that that we do see diverse populations. So, Black Americans, Hispanics, folks who actually are not, English is not their first language as well. I think that there's going to be an opportunity to reach more people in areas where there is not that person care, or if they don't have the means to go to the doctor. So I think there's definitely, this opens up more populations. And then also the more that we can have, doctors who are bilingual, perhaps also have that kind of conversation, I think it's going to make a big difference.
So that's interesting. So when you think about that, do you see telehealth as a replacement, an amplification, or potentially even detrimental to the relationship between the HCP and the patient?
So I will tell you, I loved the conversation about what was surprising when we first started this afternoon. And the fact that doctors love this, I think is really interesting because, we were blindsided by COVID, but actually telehealth in many ways has been a savior for relationships. So to answer your question, I think that the hybridization and understanding how when in person can be amplified by virtual, and when virtual is going to instigate an in-person experience, I think that balance is what's going to really stick moving forward.
Yeah, I mean, I feel the same. I have a very similar standpoint as Hillary. I will say, I tried to ponder on where it would be a detriment, and I don't see it really getting in the way of anything, because you can always have that follow-up, that in-person follow-up appointment. I recently went through an urgent care scenario where, it was both. I was in the parking lot doing telemedicine over the phone and, over Zoom, and then you go in and for whatever you need, and then it's done. So I think amplification definitely in most cases. In some areas like peds, women's health, gastro, there's certain therapeutic categories that I think it's going to stay, because those are exhibiting high growth, high volume in terms of appointments made. And I don't think that they're going to go anywhere, because those are simple conversations that you can have, whether it be a chronic, follow-up appointment or something that you just need antibiotics for. So I'm excited for that, because as a working mom, it makes my life so much easier to be able to do things, on my phone and in my home.
Yeah, I know. I for myself, it's impacted me, because I generally have gotten more frustrated with my general primary care physician because of all the challenges as it relates to dealing with them. And I can go on to, something like telehealth consult and just get connected right to somebody. So I prefer those guys more than I like my general prac anymore. I'm not even, I can't stand going to there. So I know that's impacted me. And that's actually an interesting, way to look at things is I'm curious to think how that's changing the relationship between, who the primary care physician actually is starting to become, right? Is the primary care physician even still the person we generally think of when it comes to some of these, like I have allergies as an example, and that's something I don't need to go to my doctor for that. And he wants me to come into the office so that he can, do all the things he needs to do to me. But the reality of it is I know exactly what I need. I get sinus infections twice a year. I don't need you to make me come in and charge me for that every single time.
Yeah.
So,
and I think Jeff, to that point, I think all of us have had these personal experiences, but we see more and more that nurses are an area for that general kind of triage for those, I call them everyday or nuisance kind of diseases, whether it's pink eye for your kid and you've dealt with it 14 times, or if you're an expert allergy sufferer. I think it will change kind of the dynamic of who is the carer. I think it does pose a problem for marketers, though, because understanding then who are the influencers, if that's your regular physician, do you have a virtual care physician, and then how do you connect the dots? Because as marketers, we have to go beyond just driving treatment. We have to drive relationships with all the stakeholders.
That's a really, really good point. It makes it challenging. Well, So Hillary, you drive, the organization within McCann to think really out of the box and come up with new approaches on behalf of the client. So what are some examples that you've seen of how companies are using telehealth in a way that's exciting and innovative?
Yeah, so I will tell you, I'm super impressed in the U.S. and I work in global markets, as you know, Jeff. But I'm impressed with pharmacy and the value chain. When you think about how the pharmacy retail chains are partnering with telehealth, whether that's CVS or Rite Aid, or depending on where you are in the country, Walmart, of taking a look at how you create almost like a concierge that's connected to telehealth. Because people want to know more information. Because of COVID, science is, honestly, it's a dinner conversation, right? Who knew that at our dinner table we'd be talking about science and antibodies and all these terms, right? And so people want to know more. So I see that telehealth not only is about treatment and about care, but it's also about information. And I think those pharmacies are really doing a beautiful job of partnerships from an innovation perspective.
That's really interesting. And the flip side to that is, Nina, you've worked with brands who are really leading the way with marketing and educating, even within that telehealth environment. And where do you see some gaps with regards to the ways that people are looking at opportunities within or in support of the platform?
Yes. Well, this is just the beginning. And I do think that the biggest gap that I've seen is sometimes brands aren't really willing to innovate as much because legal, right? Legal gets in the way, whether it be, the data collection aspect of everything, it not being completely HIPAA compliant, or, maybe getting a functionality to try to get a script lift right away, virtual. It seems daunting to go through that legal process because we're all still trying to kind of get our feet wet in this space. So I think, the open-mindedness to try new things, despite us always having to go through legal review, I think is causing brands not to have those conversations. And it might not be 2021, it might be 2022, but I think really pushing the envelope on this is important, to be able to innovate and kind of be first to market with a lot of these different opportunities that Populus and Ogre and all the different companies out there that are offering. I also feel that, we need to take a more agnostic approach to reaching these different telehealth platforms. So being able to have partners that can really see into, I've used 3 different telehealth platforms, for example. I'm not exclusive just to one because of the different practices that I use. So I think having a more agnostic approach, and the reality is, beyond Populus Media, there's not a whole lot of opportunity to advertise within these environments, these point of care environments, which really, requires us to fall back on, all right, well, how can I still reach these consumers in a meaningful, or these patients and these doctors in a meaningful way at the right time? So I still think that there's a major reach component to telehealth, and being able to kind of, buy segments that, people that have indications that also use telehealth to connect with them. So I think that that's kind of been a miss because people are jumping to the POC space, right? But I don't think that, again, besides Populus, that space really hasn't been developed.
Yeah, that's really interesting. In fact, one of the things that you and I talked about recently was how you at Ogre are looking at understanding audiences who are using telehealth and targeting them in other mobile applications that they utilize, which is a really different, it's kind of utilizing telehealth as a driver to drive additional reach and viewability based upon, that known behavior, which I think is really interesting. It's a different way of kind of approaching telehealth and looking at it and taking part in it, because you're really leveraging that experience without actually necessarily being in the experience in order to understand people where we might not be able to target them in a platform like Populus if, for example, Populus doesn't have a relationship with that particular telehealth platform. So I think that's a really interesting approach and way to look at it.
Yeah, Jeff, if I could also add just one other thought, is that I think a lot of times we're focusing on the patient. I do think there was a great question earlier today about doctors in medical school, and it's interesting because I work with UNC in their health MBA department, And a lot of questions are coming up about how do we help doctors be more effective in a telehealth appointment? How do we help them carry that forward with that understanding for either, whether that's using Amazon Echo as a scribe, how do we really help them be more efficient and make this something that they can master? So that could be something interesting for marketers to help doctors.
Yeah, that's actually a really great point. I mean, everything that we've been focusing on here is talking about the patient side, and there is this whole aspect of how do we connect and engage and relate to the physician and assist them in their process, because while it's, as was mentioned earlier, physicians seem to love it, I think there's still a lot of physicians who are struggling with how do I best leverage it in the most effective way.
Yeah, true. Very true.
So what do you feel is the most impactful change that telehealth is really driving within the industry beyond remote access to care?
Definitely remote access to care, being able to serve underprivileged communities where, they don't have the resources to get to their doctor. I think that, or even have the specialty in their area. That's number one. I actually have a friend who is an ABA specialist who works with autistic children. And this telehealth opportunity has not only been able to reconnect her with some of the children that she made connections with years ago that moved far away, but now she has, her specialty that she can give to anywhere in the nation to be able to, lend her services where there are none. I think that that's number one. I think, making it more affordable and accessible through insurance is going to be is huge, and will hopefully, people with chronic illnesses and conditions will hopefully reduce their cost of healthcare overall.
Yeah, I couldn't agree more. I think the only thing I'd add to that is real-time exchange. I think in addition to the people that we're reaching, the amount of times that we're connecting. I mean, how many times I've pushed off my doctor appointment so many times I can't remember. I'm also a working mom, and so I know that if I'm able to talk to my doctor 3 more times, that's data, that's input, that's going to give me better advice for me, for my family, and hopefully over time with more touch points and more real-time information, you're going to have better outcomes. So I think that's also something that could really change that trajectory.
Yeah, that's really interesting. And I wonder, we haven't really even talked about how it could impact outcomes and outcomes-based medicine. And I wonder if you have any thoughts around that. We haven't really discussed that at all today that I can think of. But I would think that, there's really probably a huge opportunity for the platform to be able to help drive and advance that, and even help justify the reasons for reimbursement for that.
Yeah, I think that it's interesting. There's the measure of QALY and PHALY, patient-reported outcomes. Everyone's looking at real-time, real-world data. Data is only as good as if you act on it or not, or information is only as good as you act on it or not. If we're able to take these conversations and then be able to make sure those conversations help people understand their health, why they're taking their treatment, and then follow up and stay in touch, you can only imagine that greater understanding is going to convert to different kind of behavior, adherence. So I'm hoping that payers honestly embark on some population economic studies to see how telehealth is really going to change that end kind of outcome for chronic disease, but also for a lot of the diseases we have for preventive care as well.
That's really great. That's really insightful. So with that, I think we're out of questions here for the panel, unless there's other things that you guys want to share and talk about. But I really appreciate everybody's time and being part of this, and I appreciate and I thank Populus for inviting us here to have a discussion. And with that, I'll turn it back over to Heidi.
Thank you, Jeff. Thanks, Dara.
Thanks, everyone.
Thanks, Jeff.
Thank you, Jeff, Hillary, and thank you, Nina, as well. And just a general thank you to all of our participants today. And with that, I'm going to turn it back over to Paul, who's got some final remarks. Paul?
Thank you. Thank you, Heidi. Thank you, everybody. Hopefully we respected your time today. I think we're ending exactly on time. And I'm just going to take the liberty here, see how I did, of sharing some snippets from all the great speakers today. If you can see that on my screen. These are just kind of distillations of what was said already, and apologies to speakers who maybe I missed some of the key points. But so telehealth is a positive force obviously in the healthcare ecosystem and concierge medicine. We heard that from several people, including Dr. Parikh. And consumers are, let's face it, consumers and physicians are adopting and liking telehealth quite a bit. It's on a very positive upward trend. 5G, as Ray mentioned, 5G and remote patient monitoring are driving telehealth adoption. And number 4, the telehealth first marketing that Russ and Howard told us about, that is happening. Brands out there are doing that, including those brands that sense somewhat loss of traction. I think Hillary mentioned loss of traction from in-office pharma detailing in this pandemic era. And can't forget digital natives and the young generation that's currently not, perhaps seeking healthcare that often, but as they get older, they start to seek it. We all know, where are they going to turn to? They're going to turn to their phone in a lot of cases and look for that kind of easiest avenue and least path of resistance, which is mobile. Sorry, a few more. Good point also made. Telehealth is possibly driving more females to become doctors. Let's hope so. That'd be a great thing. And the idea of turning multiple touch points into a kind of a playbook strategy for marketers, I thought was fantastic. Telehealth can amplify care and in many cases replace the need for an in-office visit. Some patients like Jeff now would actually just try to use telehealth exclusively if they could. Probably not in every single case, but I like it. It's a good approach to take. And I believe it was Dr. Lyle who referenced this idea of virtualists, doctors who are going to focus in the future on really just kind of working from home and doing their medical visits to the extent possible via telehealth. I think that's really cool. So we want to thank everyone again, all the speakers, McCann Health, our partner on today's event, Healthy Nation, and want to do a shout out to our engineer, Satnam. Thanks so much for making it all happen. If you want more information about Populus, there's some contact information for you. You can also just check out our website, and we appreciate it. Thanks for joining, and have a great rest of your day.